Welcome, everyone. Let me say that we appreciate that you all are on with us today. Here's the intent. There's a bunch of content out there. There's a bunch of direction out there. There's a bunch of information flying around about the pandemic. What we're after is to winnow this stuff down to some kind of manageable content, manageable chunks, so that all of our firefighters get on the same page with what we know about the pandemic and how we're going to respond to fires during the course of COVID this summer.
Certainly every year, our number one priority is firefighter and public safety. This year, those priorities remain the same. In my 44 years of fire seasons, we have never seen a fire season like this one. Firefighting is always a risky occupation. There are many hazards to be aware of in the fire environment. This year, we are challenged by a hazard we have never had to deal with before, and that is managing fire during a global pandemic. COVID-19, a disease caused by the coronavirus, adds an additional complexity to the already dangerous world of wildland fire.
As we move forward for the rest of the 2020 fire year and deal with COVID-19 issues while we respond to wildfires, I have a few thoughts to share with you. I'll start with one of the 10 standard firefighting orders. Fight fire aggressively, having provided for safety first. This year, this order applies for dual purposes: wildland fire response and COVID-19 protocols for personal protection. Think clearly, act decisively. Stay the course with utilizing time-proven wildland fire response guides, such as the Incident Response Pocket Guide, LCS, maintaining lookouts, communications, escape routes, and safety zones. But stay familiar and practice appropriate COVID-19 prevention and mitigation measures. Self-screening is important. Notify your supervisor if you have a cough, fever, chills, sore throat, or difficulty in breathing. Proper hygiene on the fire line includes washing hands, especially before and after eating. Have personal hand sanitizer available. Disinfect radios, phones, doors, pumps, and other items. Maintain social distancing and face coverings when appropriate. Remind others. Face coverings can complicate communications. Ensure effective sending and receiving messaging every time.
We're wildland firefighters, and we know that we can't do our job remotely. We have to come to the workplace. We have to travel to fires. We have to fight fire, because if we don't respond to fires, some American people are going to be at risk. And it's one of those things that we've agreed to as firefighters, is that we're going to put ourselves at elevated risk when other people aren't. And you all know that. That is what we do every day of the week during fire season. And this situation is no different. Managing risk is what we do. We do it every year, even without pandemics. As a group of firefighting professionals, we recognize that COVID risk is real, but wildfire risk is real. And we can't let worry about COVID overshadow what we know about managing fire.
Fires that pose a threat to communities and natural and cultural resources, we will attempt to keep as small as possible.
Part of our doctrine in fighting fire is aggressive initial attack. We pre-position resources as part of our doctrine of fire suppression. We have speed and focus when we respond to fires. We know that one of the best things we can do to minimize overall risk to both our communities and to ourselves is to catch fires when they're small. We're going to try to get our stuff in place before fires happen. We're going to try to catch fires when they're small, as we always do, but we're not going to take any extreme risk just because we have COVID floating around. We trust that you all, fire professionals, are going to do the job you know how to do. Try to catch them when they're small. When you don't, you pull back and manage what you can with what you've got. We don't want anybody to get overextended. We don't want people to take extreme risks, anything more than they would normally because of the pandemic. It is business as usual, and that aggressive initial attack is part of business as usual. We know that resources are going to be in short supply this year. We know that some crews aren't going to be available. We know that some of our local partners are going to be so busy dealing with the pandemic and some of the permutations of responding to health crises that they may not show up along with us on the fire line. We've done what we could to bring on all the resources we can. We brought on additional aircraft to help us out. What we don't want to see is people using aircraft in a different way than we would normally. We still manage risk. We still use aircraft when they're appropriate. But let's not transfer risk to pilots and to air crews. Let's manage this the way we do, use aircraft when it's appropriate, and we try to have as many tools there for you as you're fighting fire.
But we're also going to have to manage fires at the extended attack and the large fire incident level.
And as you staff up large fires, if you do, you should see things that are different. You should see catering is different. You should see more hand washing stations. You should see more virtual team members, folks who aren't even in camps. You should see that you're camping in different places. You're spiking out more. That all of our large fire organization tactics have been changed and modified because we really suspect that there's large fire camps that we get are going to be a potential source of transmission of the disease.
The other thing we're encouraging this year is the module as one concept. Some people call it that. Some people call it the family module concept.
We know that trying to maintain all the CDC guidance and still fight fire safely is a challenge. If you're a swamper working with a sawyer and you guys are masked up on a 100-degree day, we know that that's going to be a challenge. So there are times when we have to do things that CDC would not otherwise recommend. We know that fighting fire with masks on is going to be a challenge, and so we allow ourselves to break those rules. And the way we break those rules is to manage ourselves as little family units, or module as one, we call it. You trust that your compatriots, the folks you work with day in and day out, are free of the disease, and as a group, you're free of the disease, and you really treat yourselves as a family unit. The same way I and my family members might jump in a minivan and go to a lake, you and your compatriots jump in a rig and drive to a fire. That's the concept, where you can't maintain distance, where it's unsafe to maintain distance, where it's unsafe to wear a mask all the time. We try to manage ourselves as a little disease-free unit. And trust one another to limit our contacts outside of work so that we don't bring COVID into that family unit. Think of it as a family. And those firefighters that you see day in and day out are your family members. You probably think that anyways. And so we're just extending that to the pandemic.
So glad after the South Canyon fire in 1994, the wildland fire community decided to become a learning organization. And by publishing lessons learned and after action reviews and sharing those amongst ourselves, we've been able to adapt quickly to changing situations. This is unprecedented times. We're inventing things on the fly.
So what's important to us this year is that we monitor our physical condition. We've asked all of our firefighters to screen themselves daily to check for their temperature rising, for looking for those other sorts of symptoms that go along with COVID. And we want people to get themselves away from their compatriots as soon as they feel any kind of hint that they might be sick and to get checked out. But we have a mental, emotional health to worry about as well. Even in a normal fire season, firefighting puts an enormous strain on us and on our families. And we know we want people to be intent on that. We want to help each other, get professional help when we need it, especially this year with all these COVID kind of pressures and permutations going on at the same time that we're trying to fight fire during a busy fire season. So please, if you're having a struggle, reach out. If you see somebody else who's having a struggle, reach out to them. Don't wait for them to come to you. Just ask, check in with folks, right? Because that is as important this year as any other. Also say that there's an additional stressor on all of us this year, and that we do not want to take this COVID back to our families, right? We're putting ourselves at elevated risk, and that's what we do normally. But what we don't do normally is bring the risk back to our families, and let's be mindful of that people are worrying about that, and our families are worrying about that. It's an additional stressor, but please, one more time, just reach out when you need help and look for folks who need your help. And let's keep ourselves healthy, mentally, emotionally, physically, as best we possibly can this fire season.
We're going to continue learning with each incident because things are evolving. We're learning things about this coronavirus today that we didn't know yesterday. And so it's really important to pay attention and listen, follow the advice that you're hearing from the medical experts, the medical public health advisory team that was stood up by the fire directors to help manage this, as well as whatever you can find on the CDC websites. The better educated you are, the better you are going to be able to provide for your safety and the safety of your crew members.
Information regarding COVID-19 is extensive, sometimes confusing, and constantly evolving. Additionally, numerous information and guidance documents have been issued through national, state, and local channels to provide wildland firefighters with prevention and mitigation measures. The NWCG COVID-19 webpage is intended to be a single source for interagency resources and will be updated continually. In closing, protect yourself, your crew, and your camp. Thank you and stay safe.